Assalamu alaikum, the communication day. First scenario, you are the senior house officer in the cardiology clinic, in the cardiology ward. Mrs. Mona, 35 years old, admitted post-delivery due to short of breath and leg swelling. After investigation and cardiac evaluation, diagnosed as postpartum cardiomyopathy. Please sit with Mrs. Mona and discuss with her the full management plan, the medication, and address any concern. Ready to start?
Just 1 second, Dr. Wasa.
Okay.
Okay, now.
Okay, here you go.
Okay, hello.
Hello, doctor.
I'm Dr. Auda Karim. I'm a senior house officer covering the heart ward today. May I confirm that you are Miss Mona, 35 years old?
Yes, doctor. I'm Mona, 35 years old.
Okay, so Miss Mona, we are here to talk regarding your health condition. Is that okay with you?
Sure, doctor.
Just to be in the same page, could you tell me how much you know regarding your health condition?
Yes, doctor. I have got a baby since 2 weeks. Since delivery, I have a short difficulty of breathing and also a heart racing. So I admitted here in the hospital to know the cause and relieve my condition. Yesterday, they did some blood test and also some heart tracing, and I am here to know the news, any news.
Okay. So so Miss Mona, thank you for sharing this information with me, and I'm sorry for suffering. And also, congratulations that you have a baby now. So, Miss Mona, I'm sorry I didn't have any good news for you today.
Oh, doctor, what is? Yes, okay. What is that? It is heart attack.
Miss Mona, the result of your workup that was done for you now with me, and it reveals that you have a condition which we called postpartum cardiomyopathy.
Okay.
Have you ever heard about it?
No, doctor. It is heart attack.
Yeah, Miss Mona, it is not heart attack. But if you give me a chance, we can explain to you more regarding this condition.
Sure, doctor.
Okay. So Miss Mona, please follow me. I'm trying to draw for you to make it simple to understand it. This is your heart. This is the chamber of your heart, and this is a muscle. This actually this condition there is some enlargement or increase the size of the muscle of the heart. This most likely it happens. Either like in the last months of pregnancy or after delivery. So it related to have been having a recent baby, and this it lead this enlargement or increase the size of the heart, the muscle of the heart. It can cause your heart, the muscle of your heart to weak, and to extent that it become difficult to pump enough blood to your body and to the other organs, and in this it lead to similar symptoms such as you have, like this difficulty in breathing and swelling in your leg. So I'm sorry to tell you that. Are you understand me, Mrs. Mona?
Yes, doctor. It is serious condition, doctor.
Regarding this, yes, it is serious. Like the heart, it can lose his function. And it can lead to some disturbance in the electrical disturbance of the heart. But be sure that we are going to do our best, and we are going to provide you with appropriate and suitable treatment for this, and to prevent any further complication to happen for you, Miss Mona.
Okay, doctor.
Okay?
Yes, doctor. What is the cause of this problem in my heart? This is like my father.
Miss Muna, your concern is valid regarding the cause, as I mentioned to you. It's related to your pregnancy and your delivery. You're having a recent baby. Sometimes it can the heart muscle can become weak and enlarged in such cases, and it can affect the pumping of the blood to other organs from your heart.
Okay. Okay, doctor. But
Yeah.
it is not first time to get delivery, to get delivery. So why is this child?
Okay, I highly appreciate your concern. Yeah, regarding this, just yes, not usually should be happen after any pregnancy or after having any baby. Just it is sometimes it happen and it is rare. Yeah, it is rare and it's difficult to be predicted to happen for every pregnancy. So unfortunately now you have these conditions.
Okay, doctor. So what you will do for me now?
Okay, so yes, now just we need to involve a group of specialists. I should include the heart doctor, and also we need also to involve the woman doctor. Yes, just to provide you with appropriate and suitable plan of care, and also yeah, we need to give you some medications. One of them like water pill medicine that it can remove the excessive fluid in your body, like this swelling in your leg, and also it can relieve your symptom now, and it can help the heart to pump in good way. So and also other medications other medications that it can help the heart to pump in the better way. Are you understand me?
Yes, doctor. I am with you. Yes, doctor.
Yeah, also we need from you to do some lifestyle change, like to take rest and to avoid any excessive and vigorous exercise, and also to avoid any excessive salt and water drinking, and that just until your condition it become better. So are you understand me, Mrs.
Yes,
Mona?
doctor. Yes, doctor. I am with you.
Okay, so do you have any concern for me?
Yes, doctor. Can I have a baby? Another baby or no?
Mm-hmm. Mm-hmm. Okay. So, Ms. Mona, yes, this concern is quite valid. Yes, you have yes, you have a chance, and you have a chance to get a baby in the future. So, but before you and we need your pregnancy should be planned between the heart doctor and the woman doctor. Because I'm sorry to tell you that this condition might be happen for you again. That is why we need to follow you and we need to monitor your condition. So,
Okay,
are
doctor.
you understanding me?
Yes, doctor. Yes.
Yeah.
I only I wanted to know if my heart will be normal again or not, or will be like my father, have heart attack, and he's
Mm-hmm.
suffering more, suffering a lot.
Mm-hmm. Mm-hmm.
So I will be suffer like my father.
Mm-hmm. First of all, I'm sorry for suffering of your father. So regarding your situation is quite different from your father conditions. So regarding this, yes, your conditions can be
2 minutes
you can
left.
recover back and be uh,
Sorry, doctor. So, is my side or your connection?
Yeah, I think
Okay.
from Dr. Sarah connection.
Yes.
I will pause the timer.
okay. Okay.
Yes.
So are you hearing me now? Yes, you are hearing me now?
Yes,
Yes.
doctor.
Okay.
Yes, doctor.
Okay. Yes. So regarding the last concern, you are hearing me?
No. Is my
Okay.
heart will be
So
normal, doctor, or will be have suffering like my father?
yes. First of all, I'm sorry for suffering of your father, Miss Mona. But your condition is quite different from the condition of your father, actually in your conditions, most likely many of cases they will get a good recovery. But this with good follow up and with good when you are take this medication and you are doing some lifestyle modifications, Ms. Mona.
Okay. So, doctor, is there a chance to my heart to be normal?
Yes, Miss Muna. Yes, most of cases the heart it can recover well, but I'm sorry to tell you that the minority of such cases it might be this heart problem it persists for you. But
Okay,
don't worry regarding that. We will provide you with appropriate care and we will do our best to help you regarding this.
okay, doctor. I have a concern. Can I lactate my baby?
Yes, yes, Miss Muna. Yes, you can get a baby and
No,
just
lactate my baby.
Dr. Sarah, again, your connection is interrupted. Please try to connect well. We cannot hear you, Dr. Sarah. Sorry. If you can reconnect back, please. Disconnect and reconnect back. You can hear me, Dr. Mahmoud?
Yes, I hear you, Dr. Basim.
Okay. So we'll wait for him.
Okay.
yeah.
Yes, the last
Okay,
concern,
so
Dr.
now
Sarah, we couldn't hear you well.
yes,
Yes, please. Yes, it's clear now. Please
Yes.
answer the last one.
Can I lactate my
Yeah,
baby,
yes.
doctor?
yes, okay, thank you for sharing this concern for me. Regarding this, yes, you can lactate your baby, but before that, just we need to check your medications that you need to be received in this time, because yeah, some medications can be not to be used in the lactations.
Mhm.
Okay, is that okay with you?
Yes, doctor. Thank you. So, is this okay, doctor? Thank you. Thanks, Dr. Sarah.
Okay, do you have another concern?
No, doctor. Thank you very much.
Okay, so may I ask you some question?
Yes, sure.
Okay, what you are doing for living?
Yes, I'm a housewife.
Okay, so how much your condition impact your usual daily activity?
Yes, doctor. More, doctor. I have tiredness all the time.
Okay, I'm sorry for that. Yeah, I understand your situation. Is with whom you are living, Ms. Mona?
Yes, with my husband.
Okay, so your husband he's able to help you regarding your baby and your conditions, or
Yes,
you are
doctor.
need any kind of help from us?
No, thanks, doctor. Thank you very much.
Okay, so do you smoke?
No,
Do you drink much alcohol?
no.
Do you drive?
Yes.
Okay, so Ms. Mona, yeah, we need from you to stop driving until your condition become better.
Okay,
So
doctor.
is that
Thank
okay
you.
with you?
Yes, doctor.
Okay,
Thank
so
you.
could you tell me how much did you get from our discussion today, Ms. Mona?
Yes, doctor. I have.
No, time is up already.
Since
Okay.
yes.
We added for the social support only, not for
Okay, because
recapping.
of that.
Okay.
Okay, the internet, okay.
Dr. Mahmoud, you can
Okay,
comment
Yes.
so
now.
Yes, Dr. Sarah, this is a long scenario. I know, but you did it well. But the tricks in this scenario is to show the side effect of the drugs. So first I told you you have to tell me what is the expectation. I will tell you I expect doctor it is heart attack like my father. So no, it is different from heart attack because it is a concern. It is a hidden concern. Okay, then explain. Just to explain the postpartum cardiomyopathy that it is failure of the heart to pump in normal way. That's why you have your symptoms like shortness of breath and heart
Dr.
racing.
Mahmoud, just to be accurate, it's peripartum cardiomyopathy.
There is peripartum or postpartum, Dr. Basim, because many patient peripartum is before delivery and after delivery. But postpartum when comes after delivery. I think is it. So there is two names to peripartum. Maybe peripartum cardiomyopathy, which happened before the delivery, and the postpartum can happen after the delivery.
No,
What I
peripartum
remember,
mean
Dr.
before
Mahmoud,
and after.
yeah, both of
Peripartum
them
Yes,
the
around
same.
before
around
and
the
Yes.
delivery.
Okay,
Yes, both
yeah,
of them the
both.
same, the same. Yes,
okay, no problem.
including both. Yeah, the pre and during
That is
or
why I'll
after,
explain,
6 months
the
after.
last pregnancy and after delivery. Yeah.
Yeah.
Yes. Okay, so
Okay, continue. Yes.
yes, okay, Dr. Bas. Okay, so peripartum, it is a failure of the heart to pump in normal way. The tricks in this case is explains the side effect of the drugs. I write in the scenario, it came like that in the exam, management plan plus medication. So we will discuss the medication of heart failure, which is the first diuretic. It is a water pills to decrease the accumulation of the fluid, and there is the bad effect, maybe loss of minerals. So it is important to check your blood test for minerals. That is the first. And the second drug is called angiotensin converting enzyme inhibitor. It is a very important drug which acts on the heart, so improve the function of the heart. But there is a bad effect from this drug may induce cough. So when you have cough, we can replace this drug. And the third drug, it is called beta blocker, which is slow, because the patient comes, I tell you, I have racing heart. So beta blocker will slow this racing heart, which can decrease the blood load in the heart, so the heart can pump normally. But he has also bad effect, like may cough or asthma-like. So whenever you have cough, you should report it to the doctor to change the medication. Okay, the concern and the concerns of the patient, is this serious? Yes, it is serious. If not treated, does my heart will back normal? Yes, appreciate your concern, but most majority of the patient have a chance to be normal, but some patient can affect the heart all life. Okay, and the concern, can I get a baby again? I advise, we will assess you and advise you and refer you to woman doctor. But I'm sorry to tell you that this condition can come again, and when come again, it will be more worse. So I advise you to think about this matter. And if you want to anytime to be pregnant, it should be planned pregnancy, like you said, Dr. Sarah. Okay, you should tell me, what about your baby? How is he doing in home? Does you lactate him? You should tell me that, and I tell you I can't lactate my baby. I have shortness of breath. So we will assess you, and if you have any difficulty with lactating, you can lactate your baby by like many methods like bottle feeding till you improved well and can lactate your baby. And I will one concern of me that okay, doctor, this medication, if I lactate my baby, will affect it will affect my baby? No, all medication of peripartum cardiomyopathy can't affect the baby. Otherwise, we change the beta blocker to any medication. But
Except ACE inhibitor. ACE
I think
inhibitor?
no,
Yeah.
ACE in lactating normal, Dr. Bas. Many patients with peripartum cardiomyopathy take ACE inhibitor. The only contraindication in lactating is amiodarone, and I think labetalol. In lactating, not in pregnant.
I kind of disagree with you, doctor.
Yes.
Sorry. Hello.
Okay.
Yeah, Dr. Emeka, continue.
Yeah, I kind of disagree with you. You know, I've been managing PPCM patient for the past, 5 years. Looking at my own experience of PPCM, you don't, ACE inhibitor is contraindicated in the first few months of lactation. If you want to consider anyone, the closest you usually give is enalapril. It's the only one amongst all the ACE inhibitors that may be considered in the
Okay,
in lactating.
yes, another plan
Outside
is
the nalaprio, you can give a trial for nalaprio, but lisinopril is contraindicated, losartan is contraindicated within the first few months. Then, if subsequently, if the PPCM persists, you might want to consider those ones. But in the first, within the peripartum period, we try as much as possible to avoid ACE inhibitor, except if we want to consider, we eventually consider enalapril, which has been shown to be safe amongst all other ACE inhibitors. That's from my own experience, and from being the fact that in my center in Nigeria, we have we see PPCM patients on daily basis.
Yes.
You know,
but
yeah,
Dr.
thank you.
Henry, whenever Dr. Basim tell it is contraindicated, it is contraindicated.
Yeah.
It is a guidelines, Dr. Basim
Yeah.
guidelines. Yes.
It's evidence. I searched about it. Yeah, there is some of the medication can pass to the baby, so it's dangerous. Or at least you refer the patient to the woman doctor along with the pharmacy doctor, and they can decide which medicine will be safe for the baby. Okay, now we are talking about the baby.
Yes, it is a trick in this case scenario also. Safety netting. Okay,
Yes.
tell the mother you should monitor your baby. If lactate your baby, if your baby has any weight gain, any heart racing, you should report it to child doctor also.
And how she will know the baby heart racing?
If he is anxious, it is from me. Really, Dr. Faisal, it is from me.
Okay, thank you, Dr. Mahmoud.
Thank you,
It's
Dr.
new
Basim.
scenario. Among all the session, we didn't do peripartum cardiomyopathy as a communication. We did it as long clinical consultation. This is the first time to do it as counseling, which is good also idea to practice it. Maybe it will come to the exam. I didn't hear about it in the exam. Did you hear about it in the exam?
Actually, the first time, yeah.
Yeah. Anyway, we are here to practice all the new sessions and the new scenarios. You don't know what will happen. They might bring any case because it comes as long clinical, so it might come as communication. Okay. Let's talk about. Yeah, I will repeat the same concerns and the answers, confirming and proving the answer of Dr. Mahmoud. I agree for all, apart from the medication. Since they wrote, please address the management plan, you have to talk about the possible management plan, not only the pharmacological part. You have to talk about the non-pharmacological part. Group of doctor already mentioned, right, by Dr. Sarah and by Dr. Mahmoud. The alcohol smoking, you can give it initially while talking to the patient how to manage. No need to wait till the end. Do you smoke? Do you? Because harmfully, this habit will affect and will be harm to the heart, right? Whatever the amount, either smoking in little amount or the alcohol itself will harm the heart since or while the patient is doing it. So let's go back before asking about the question about the social. You can give it as advice. Please be sure that the smoking and alcohol are harmful to the heart, and it might harm the heart more than it is now. The other options, the pharmacological already mentioned, ACE inhibitor, diuretics. You can talk about also a device, ICD, right? If there is arrhythmia or if there is also heart failure, you can talk about the other device, which is Dr. Mahmoud. What the other device for heart failure?
देखो पेपर में हल्के छोटे छोटे सुराख हैं लेकिन
Sorry?
mean
The other device for
other device, ICD or CRT?
yeah, CRT, cardiac resynchronization therapy.
Cardiac
Yes.
resynchronization therapy.
Yeah, this is the other, the third and the last. If she asks you, is it curable? What do you think? The last choice.
मोबाइल देना मेरे
Sorry, I will mute.
It varies. It has variation.
Sorry.
It varies from one to another.
Yes, ICD and CRT if the patient has
Yeah,
arrhythmia.
this is the in advance. If there is arrhythmia or heart failure. Okay, what if the patient already the heart failed to pump and at the end stage of the heart With
Yes,
the option will be
heart transplant.
exactly, yes.
Mhm.
If she asks you or if she raised this issue, yeah, there is possibility to be cured by doing a surgery, by transplanting another heart, which is also very difficult. However, majority of the patients might be fine, but some of them they might have the symptoms temporary or permanently, not temporary, permanently. Okay. The last concern regarding the baby, yes, the next pregnancy, yes, the next pregnancy will be dangerous for you as well as for the baby. Okay, so please follow with your woman doctor, and she will address you your concern regarding the possibility to have another pregnancy. It will be safe for you or the baby or not. The third concern I wrote them because it's a good concern, really. Yeah, it's serious. Yes, of course. I appreciate your worry. It's serious if left untreated, right? It might end up with a heart failure and even pulmonary edema, and maybe the patient will fail, or he will have, or she will have respiratory failure. Uh, is it heart attack? Yes, you already answered it. No, it's not heart attack by per se, but it's similar to heart attack because the heart attack will end up with the failure of the pumping of the heart. But this one is different and it's unknown mechanism. No one knows why it happened during the last day of the days of pregnancy and around the delivery and post delivery, right? Can I have another baby? We already mentioned. Will I suffer like my father? Unfortunately, sadly, yes, some patients suffering from these symptoms that you have, and they might, or these symptoms might persist. Will my heart will be fine again? Yeah, as I said, some of patients, but the majority will be okay, but some of them, they might continue as in failure. The heart will be which is called cardiomyopathy, right? Dilated cardiomyopathy. So it might be as a permanent one, or it might be recovered completely. Can I breastfeeding the baby? Yes, we answer it also. Breastfeeding, some medication might be harmful, and to be safe for you and your baby, please you revise the medication with the pharmacist along with the woman doctor. This is my opinion. Anyone has a suggestion?
woman doctor and the heart doctor, the pharmacist.
Yeah, yes,
just
clinical
different
pharmacists.
them أقوله. Yeah.
The clinical pharmacists know how what the medication are safe and what the medication are dangerous, along with the heart
Okay.
doctor, of course. Yes, heart doctor, woman
Yeah.
doctor, and
Yeah.
the pharmacy doctor. I mean the clinical
Okay.
pharmacist, but you cannot say clinical pharmacist, so it's a
Okay.
pharmacy doctor. Okay.
Yeah.
Yes, the definition, of course, you have to say the pumping function of the heart will be impaired. Okay,
Mm-hmm.
that's why the fluid
Regarding, yeah.
will be collected inside your body in the form of leg swelling, eye puffiness or swelling around the eyes, and some fluid in your lungs. That's why you are unable to take a breath. Okay.
Regarding the medication, also I should mention like bisoprolol, ACE inhibitor, like this.
Yes, it's
Even not mentioned in the scenario, or just as
mentioned as management plan. So what are the
yeah,
management plan you are talking about to the examiner or to the patient? You have
yeah,
non-pharmacological and pharmacological. About
yes,
pharmacological, you have to mention some of the medication, which maybe the cornerstone, like beta blocker, after of course controlling the acute heart failure,
mm,
and the ACE inhibitor. This is also one of the medication improve the mortality and the cardiac function. And you might say about the antiarrhythmic, if there is heart palpitation or awareness of heartbeats, there is some medication can help in reversing the heart to normal beat. Okay.
okay.
Other question, Dr. Sarah?
No, thank you.
Dr. Mahmoud, you want to add anything else?
Thank you, Dr. Basim. Thank you very much.
Okay. So
Hello, Dr. Basim.
Yeah, Dr. Ala.
Actually, Dr. Basim, I discussed this case with Dr. Mahmoud before,
Okay.
Yes.
and I had also the same doubt that if the medication is not mentioned in the
Yeah.
scenario, why I should mention every medication? How I know they will give ACE inhibitor or they will give hydralazine? How I know that they will give beta blocker or they will not give beta blocker? Which type of diuretic they will give? So I think it's better to mention in global.
As general,
Like we
yeah.
will give you, we'll give you some medicine to decrease the load in your heart to improve the heart function. We'll give you some medicine called water pills to decrease the fluid from your body. Especially, it's
Yeah.
not mentioned in the scenario the specific medication that will be given to the patient. And the scenario already is loaded. It's loaded with counseling
Yes,
about
it
the
will not
condition.
be. It will not be in details,
Yes.
either
Yeah.
pharmacological or non-pharmacological, or in briefly about the pharmacological option. So, as you said, you will not talk in details, and you will not talk also about the side effects. You just give a hint about the possible medication she might receive, and the possibility to be avoided during the lactation or breastfeeding. That's it. But no need to mention the name of. I am talking about what possible medication, but to mention all of them by the names, it's not necessary. You can talk about the water pills, which is the most important, the ACE inhibitor, as well as the beta blocker if controlled. If she asks you in details, but I don't think she will ask, you can talk about the options. But the most important is the non-pharmacological option. So you have to talk about the smoking, alcohol, and also vigorous exercise. You can also give her
Dietitian advice. Yeah.
dietitian, restriction of the fluid, sick leave for her if she's doing some jobs. Otherwise, yes, the medication, as Dr. Ala said, it's not enough to explain all the details of the medication. Okay. Thank you, Dr. Ala. You want to add anything else?
Yeah, about the counseling, about explanation of peripartum cardiomyopathy.
Yes.
Dr. Sarah said it's enlargement of the heart muscle.
Mhm.
I think it's not the appropriate description of the peripartum cardiomyopathy. They may get it as a hypertrophic cardiomyopathy because he said enlargement of the heart muscle.
What's I know also, it's dilated cardiomyopathy rather than
Yes. Increase the size of the heart.
yeah, dilated one, right? It's not
Yeah, not
hypertrophic one.
hypertrophic. Yeah,
So it's dilated.
yeah.
I think you can say enlargement or dilatation or
Yes.
being bigger without good function. The most important here to mention the pumping function
Yeah, the
of the heart.
pumping failure. Yeah, the failure
Yes,
of the heart muscle.
exactly. Yes. So this is the main function of the heart will be impaired due to this. But how and why, it's unknown. Agree all of us for about its unknown mechanism. No one knows why exactly happened, but it happened during the last days of the pregnancy, along with the last during the delivery, as well as postpartum or after delivery by 6 weeks or during 6 weeks after delivery. Right? Any other
Yes,
comment,
yeah,
Dr. Ali? Yes.
yeah. What about driving in this case?
She's in hospital. I don't think she will drive back. She asked also about her husband, how he's doing with her. I think still, I think she's in the wards. Anyway, if you are planning to be discharged, you can talk about these things. Instead, you can say someone can take you home or drive you home because you will not be able to drive. But as a condition, I didn't hear about DVLA restriction related to the peripartum cardiomyopathy. I didn't read about it before.
The heart failure itself, no restriction.
No
I didn't hear
restriction.
also about heart
No.
failure. The heart attack, acute things, yes, but it will be chronic case.
Yeah, I think if you are in doubt, you can ask here. Like you can manage during driving. Is that
And
okay, or you have problem during driving only like this? Yeah.
why she will have symptoms? She's not running while sitting.
Yeah, yeah. I mean, you
The,
can
yeah,
manage during driving. Any
the car
problem?
is the,
If in doubt, but there is
the
no restriction as you mentioned. Yeah.
yes. Okay.
Okay, قال لك okay, regarding the drive, if the mild or moderate or patient, if the patient is stable, yes, he can drive. But if severe, should stop driving until his symptom improve. Treatment.
Okay, you are talking about NIHA classification of heart failure. You are talking about the classification.
Yes, general as a heart failure, yes.
Okay.
So in this situation, yeah, I'll
Anyway, you
advise
cannot.
until his condition
I don't
becomes
think
controlled.
you'll have the time. Even you ask it after 10 minutes and maybe 12 minutes. If you talk about all these options and the medication, the devices, and if she has also concerns, you will not reach to the extent to ask about driving. But if you have time, by the way, if you have time, do the safe thing for the patient. Driving, alcohol, smoking, and the support, the job, all the things, you have to do it. Optionally, you can't add the driving if there is time, but if no time, you have to talk about the task itself. If there is task, finish the task first. Okay? If you want to be as neutral or a diplomatic way, ask her, what do you think? Will you have a symptom while driving? Do you think it's affecting you while sitting? Or if you are sitting, you have any of these symptoms? You can say it like this, and if she said so, you can raise the issue of driving. Or for me, as acute stage, I will offer someone to drive her home. This is the best way to address the driving. So you not allow her to drive, and at the same time, you ask someone to help her to go back to her home. Okay. Let's talk about the second scenario. I will read the scenario for you, Dr. Mahmoud. Hopefully
Yes.
you read it.
Read
And,
it, yeah, yes. Yes,
I will
read.
try to read. Yeah. I will give some time also to read the comment, then we'll start. You are the senior house officer in the medical ward. Mr. Kumar, 34 years old, known case of inflammatory bowel disease on mesalazine, enema, and patient refused enema. Missed follow-up and developed flare-up of the inflammatory bowel disease. The consultant commented steroid, and the patient developed avascular necrosis of the femoral head from the steroid. The task to set myths with the patient, explain the disease, and address his concerns. I think someone will share evidence. Captopril, enalapril preferred very low level in breast milk, considered compatible with breastfeeding. Lisinopril, less data available, but small amount are expected. Often used, it benefit outweigh risk. General caution, neonates, especially premature infant, are more sensitive to hypotension and renal effects, so monitoring is advised. In conclusion, are not contraindicated in this, but captopril and enalapril, the best studied and recommended. Beta blocker, labetalol, propranolol, metoprolol, generally safe. Preferred options, they pass into breast milk in very low amount and are not expected to cause adverse effects. Atenolol, acubitol, nadolol, and sutalol. Less preferred as they are excreted into milk in higher amount and may cause accumulation in the infant, especially neonate and preterm babies. So the conclusion, beta blockers are not an absolute contingent in breastfeeding, but the choice of agent matters. And as well as for the acute state, if the patient in acute heart failure, it's contraindicated. ICD, yes, we mentioned CRT. Thank you, Dr. Tahani. I think no need to speak about devices in peripartum cardiomyopathy, as most of patients will recover. Some surrogates, they want to test your knowledge. What further? What if I have advanced? If there is an option. For the clinical judgment, you have to know them. And also for the long clinical consultation, it's one of the options you might reach if the patient failed on the medication. I'm just giving the possibility and enumerating the options how to manage the case. But definitely, they might not reach to this level of management. Planned pregnancy woman doctor, Dr. Maida, and heart doctor to consider the birth protective method until clear from heart doctor. She mean the contraception. Mention bromocriptine, Dr. Al-Huda. Bromocriptine for the stopping lactation, you mean?
I think, Dr. Bassem, there is a lot of causes of peripartum cardiomyopathy. One
Okay.
of them increase prolactin. So I think they give bromocriptine for decrease.
Bromocriptine, yes.
For decrease prolactin. One of the causes of peripartum.
Okay.
But the other cause may be not known. Maybe
It's theories, right? It's
yes, it is
theories.
serious.
Okay. Okay, Dr. Maida, better to mention the plan by sign posting to make sure the patient is attention with you. Yeah, I think she did. And the Breaking Bad News also was good to use because she might end with heart failure. Monitoring with echocardiography, yes, Dr. Imaka. You can draw. I agree to if you can draw, you can draw. Simple, your heart become weak to pump the blood causing your symptoms. Yes, we did this. Okay. Candidate said it's due to heart muscle enlargement, but it's not enlargement, it's dilated of the heart chambers with failure of pumping. Yes, so it's dilated chambers, not enlargement of the muscle. But she meant enlargement of the heart globally. Anyway, you can draw better and show the heart chamber is being bigger and dilated, and this affects the diastolic and systolic function. Postpartum is part of the yes, exactly. Post still in the okay. Let's start. Dr. Mahmoud, ready?
Yes, ready, Dr. Bassem.
Okay,
Yes,
here you go.
Okay, good evening. I'm Dr. Mahmoud, Dr. in the Senior House Officer in Medical Ward today. Let me confirm you are Mr. Kumar, 34 years old. Hello?
Dr. Sarah? Just a second, Dr. Mahmoud.
Okay, Dr. Bassem.
Dr. Sarah, you are mute. If you are still with us, we cannot hear you. Just
Okay, I'm
unmute yourself.
sorry. I'm sorry.
Okay.
I'm sorry. Yeah, I'm talk while yeah.
No worries. Yes, here you go.
Okay, you can start. Yeah.
Okay, good evening. I'm Dr. Mahmoud, Senior House Officer in Medical Ward today. Let me confirm you are Mr. Kumar, 34 years
Yeah,
old.
doctor.
Okay,
Yes.
Mr. Kumar, we are here to discuss about your condition and also update you about your condition. Is it okay with you?
Okay, doctor.
Okay, Mr. Kumar, before I start, can I know how much you know about your condition?
Yes, doctor. Actually, I have some bowel problem, doctor. Recently, doctor, I'm suffer from the pain. Yeah, it put in my thigh, doctor. In the upper of my thigh. So I came here, doctor. So please tell me what happened for me, doctor.
Okay, Mr. Kumar, I'm sorry for your suffering. Can I know, do you have any expectation? Do you expect anything?
No, doctor.
Okay, let me explain to you. Okay, you have, like you mentioned, you have a bone beam, and we did some scanning to your thigh bone, and the result had been revealed. And I'm sorry, I have not good news for you today.
What do you mean, doctor? What I have exactly, doctor? Why I have this pain?
Yes, Mrs. Kumar, you have a condition called avascular necrosis. Do you have any idea about this?
No, never.
Okay, let me explain to you, Mr. Kumar. That is the thigh bone. It is long bone, and there is a head in the top of your thigh. And avascular necrosis means that there is this of the bone tissue of this top bone, in the top of the thigh bone. It is due to lack of blood supply to the bone. And to be honest with you, Mr. Kumar, I see from your notes you are on steroid due to your bowel disease.
Doctor.
Yes, so it is one of the main causes of this decreased blood supply. That's this steroid. I am sorry
What,
for
doctor?
this. Yes, I
You
am.
mean, yeah, this condition just because of I'm taking this steroid, doctor?
Yes, I do understand your concern, Mrs. Kumar. Yes, steroid, one of the bad effects of this medication can cause thinning of the bone and decrease the blood supply to the bone. So it is one of the bad effect from this medication, yes.
So, doctor, why this medication given for me if it causes problem, doctor?
I do understand your concern and appreciate your feeling, Mr. Kumar. I can see also from notes that you have a bowel disease called inflammatory bowel disease. Do you have any idea about this disease?
Yes, doctor, I have this problem, doctor, since long time, yeah.
I appreciate your knowledge, Mr. Kumar. It is a disease of a problem in the defense system, and steroid is a good choice for control of your defense system activity. It is prescribed by the consultant, and I can see also from your notes that you missed the follow-up. Usually we prescribe this medication and follow up the bad effect.
Doctor, you mean that because I miss my the follow-up, doctor, you give me this bad medication because for me this problem?
No, absolutely no, Mr. Kumar. I didn't mean that, but as you know, it is a disease of the defense system, and we escalate the medication from the medication from taking from the bad passage, and then we have escalate the medication to another medication to control your defense system activity. That's why we give you this medication. This medication, Mr. Kumar, in the best interest of your condition, to control your symptoms of this bowel disease and also to prevent any complication. Also, there is a bad effect from this bowel disease, and we have to control this bad effect by giving you the medication of steroid.
Okay, doctor. So before we prescribe for me this medication, why no one tell me regarding this?
I really I do understand your concern, Mrs. Kumar. But Mrs. Kumar, did anyone inform you the bad effect of steroid?
No, doctor. Regarding this, no one tell me it can cause for me like this, doctor, and it can damage my thigh bone.
I am really sorry for that, Mrs. Kumar. But in usual practice, we discuss with our patient the benefit and the bad effect of any medication prescribed to him, and also share with him the whole management and the whole plan. So I can't judge what happened, but usually we discuss with my patient. So I am sorry for
No,
that,
doctor.
Mrs. Kumar.
I want to raise a complaint regarding this, doctors.
I do understand your concern, Mr. Kumar, but believe me, steroid given to you in the best interest of your condition to control your symptoms. But it's totally you're right. I will guide you to the office, which is Pulse Advice Lesion Service, who can help you about your complaint. So you're right, and be sure that the whole management plan will not differ, and we will give you full support about your condition. Is it okay with you, Ms. Kumar?
Okay, doctor.
Can I explain to you the plan now?
Yes. Please tell me what you are going to do for me.
At the time being, Mr. Kumar, I will refer you to a group of doctors, like gut doctor, to give you some medication to relieve and improve your gut condition other than steroid. And also, I will involve in this team the bone doctor and also the bone doctor to give you proper plan to this bone. We have options according to the bone doctor decision, may give you some medication, and I'm sorry to use that, he may escalate to a surgery option. How does it sound with you, Ms. Kumar?
Okay, doctor.
Till now, do you have any concern, Mr. Kumar?
So, doctor, is it serious, this condition?
I can imagine how it is very bad news for you, Mr. Kumar. But I'm sorry to you that it is serious, if not related. At the time being, I will involve the bone doctor to give you a full plan and management. Is it
Okay,
alright
so
with
can
you?
I get back to my normal, doctor? Is it treatable?
I appreciate, I do understand your concern, Mr. Kumar. It is early to say, it is according to the size and also the site of this bone tissue, and according to the decision of the bone doctor, which is may need some medication or surgery. So it is early to say it is treatable or just controllable.
Okay.
Can I ask you some questions, Mr. Kumar?
Yes, you can.
Can I ask what do you do for a living?
Yes, doctor, I'm taxi driver.
How much symptoms impact your daily activity?
Yeah, I'm not able to move even, doctor. So how can I drive? Can I do my job, doctor?
Yes, Mr. Kumar, I can imagine how it is very difficult for you. But I will give you you work taxi driver at occupation or not as a company
Yes, doctor.
or
Yes,
private.
this is the only one. Yeah, the way to get the money, doctor.
Okay, do you work at company?
No, doctor.
Okay, Mr. Kumar, I can involve the social worker who can give you full support and I will help you about this issue. Do you smoke, Mr. Kumar?
Yes, doctor.
Okay, I advise you to stop smoking because it has a bad effect for your gut problem and also for bone problem. Is it okay with you?
Doctor, regarding my bowel problem, actually, it improved, doctor, when I'm smoke. That is why I do smoke.
I do understand your concern, Mr. Kumar, but there is a lot of medication can help you about your gut problem. Smoking can affect the problem in your bone tissue, that is in bone tissue. It is advisable to stop smoking also.
Okay, I will think regarding that.
Thanks, Mr. Kumar. Do you drink alcohol?
No.
Okay. And I think, Mr. Kumar, you have to inform in driving agency about this problem in your bone, so you can't drive, and we will assist you after the plan of bone doctor to tell you how much you will stop driving.
Okay.
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 Anyone? Thanks.
I lost the connection for some minutes. That's why I think we reached the 10 minutes.
Yes, I think we reached also.
Yeah, sorry, I lost the connection from my side. Okay. So
Okay.
yeah, I think we covered the old scenario concern. You have other concern, Dr. Sarah, you want to add?
No.
Okay. Let's have the comment first, Dr. Sarah, then I will comment. Well done, Dr. Mahmoud. Yes, we can start with Sarah.
Yes, well done, Dr. Mahmoud. You did well, as usual. Just regarding the concern, why no one tell me? Yeah, just you can deal with it, and also we need from you to apologize regarding his situation and to raise incidents report. Okay, so also we need to reassure him, and this it is not in our usual practice. So before we are giving any medications, any patient some medication, we need to explain for him regarding his bad and the benefit effects. Okay. But we apologize a lot for you, and we can raise incidents report regarding this, just like this. Okay.
Okay.
So also
Smoking.
okay. Yeah, regarding your smoking, yes, you did. Just as general health, okay?
Okay.
It may harm your health as general, so we advise you. Regarding your bowel problem, don't worry regarding this. We will give you and provide you some medications to help you regarding your bowel problem. Okay?
Okay.
And also, yeah, okay. Yes. Regarding the
are you punishing me?
the condition,
Are you punishing me because I am not following up with you?
Yes, regarding this, he did well, yeah. Not like that, but what happened for you, like side effects, and yeah, these medications was prescribed you in the best interest of your condition, and also we need to reassure him or assure him that this medication was prescribed for him because he didn't able to use other options like the enema, because the mention in the scenario the patient refused to use enema. That is
Yeah.
why it would prescribe for him these steroid medications.
Yes. How can I tell the patient enema?
Like
I,
yeah, like what like I mentioned now. So
enema, just enema. I tell him the enema.
No,
yeah,
medication.
other
Sorry for
options,
this.
other
Through your
options.
back passage.
Yeah,
Medication
through the
passage.
back passes, yes.
Okay.
Another options, yeah. Okay, that is all. Thank you, Didier. Regarding the explanation of condition, yes, you can draw for it. It is beta. This the thigh bone and at the top of the thigh bone, your bone it became damaged, and the cause of this is the lack of blood supply in this area. I'm sorry to tell you that this is related to your steroids that you are using, and this is the rare complication or side effects. Okay.
Yes. Okay. Thank you, Dr. Sarah.
Okay. Regarding the recovery, okay, regarding the recovery, just this it depends on which stage your bone is damaged. So that is why I'm sorry to tell you, yes, sometimes it can be recovered if it early stage, and if it late stage, I'm sorry to tell you that it's not recovered without any treatment, like surgical or other options.
And the driving, Dr. Sarah. Sorry.
Yes, the driving just to over the social, yeah. You did well.
Okay. Stop driving. Yes.
Yes, because he's already unable to drive.
Yes. Okay.
Not really, yeah. Okay. Thank you, Dr. Mahmoud.
Okay, thank you, Dr.
Thank
Sarah.
you.
It's straightforward scenario for medical error. This scenario came to me and I did it as medical error and I got the full mark. So it's medical error. Why? During the discussion, the surrogate told me no one informed me about the possible side effect. I told him it's written that the doctor told me. Sorry, I told him the consultant told you about the mistake. He said no, he wasn't a consultant. He was a junior doctor and he didn't tell me. So there is two mistakes. The junior sit with him and he didn't tell, and he wasn't a consultant, and the task was a medical error. So I remember this scenario very good. This is a medical error, Dr. Mahmoud. You have to apologize
And
first.
today's incident report, just yeah.
Yes, insert report, everything. And the good thing you said, we didn't mean that, or this is not our usual habit. We always say the possible side effect to every patient, and we are sitting with every patient telling him about the possible side effect and the common one. However, we apologize on behalf of the whole team about this mistake, and be sure this is not intentionally happened. We didn't mean it, and we take it seriously, and we did a lot of action. First of all, the medication stop or hold the medication, because you cannot stop the steroid abruptly, because it's also one of the concern. Will you stop the steroid? Yeah, in the scenario of any steroid, patient dependent on steroid, you shouldn't stop the medication abruptly. So you can say, we will hold and we will call the doctors to adjust the dose of your steroid. Okay? The other concern, let's talk about the other concerns one by one. Yeah, you give me the medicine because I am not following up with you. Yeah, I'm so sorry if you understand the matter like this. We didn't mean to do that. What I meant, and you can explain. We give the best interest of your condition after failure of the previous, or after no response to the previous medication, for example. That's why we escalate, or we find another medication which is in the best interest of your condition. And there is also policy guidelines. You can talk about the step-by-step management plan and explain to him it was in the best interest for his condition. No one informed me already. We address it as a mistake. You have to do the action, the medical action, and the legal action. The driving here, you can tell him, I will give you sick leave. No need to ask him if he's sponsored or his car. You have to stop driving temporarily because you are not able to use your leg nowadays. Okay? The smoking, yes, I appreciate your knowledge about this information. Yes, theoretically, smoking can help. However, the smoking in general harm the all health, and it might harm the other organs like your lungs, some cancers related also. So in the best interest of you, also we need from you to stop the smoking. Any other concern? I think we cover. Is it medical error? Yes, it's clear medical error. Okay. Any comment, Dr. Mahmoud, Dr. Sarah?
Thanks, Dr. Bassem. Thanks, Dr. Sarah.
Okay, you read the comment quickly. Anyone has comment, please feel free to comment. I'll try to read the comments quickly. Medical action, Dr. Aisha. Medical action. Yeah, Dr.
Bassem,
Aisha. Yes.
This patient in the scenario mentioned that he's missing follow-up. So I think it's better to ask him why, any reason why he's not coming for follow-up. I think it's because it's mentioned already in the scenario that he's not coming for follow-up. So we need to ask him any reason, because if he has a specific reason, we can offer help for him.
Yes,
Like he has problem in his
agree.
work. Yeah.
Yes, I agree 100%. And in my scenario, it wasn't like this. It was he's embarrassed to use the animal, and he didn't use it at all. It was like this, but it comes in different ideas. In this scenario, he didn't, or he missed the follow-up. That's why he missed the instruction about the medication. But he should be informed. Okay, someone, yes, the doctor wrote, we should believe, yes, we should trust and believe the patient. Since he's saying no one informed me, means no one informed him, and you have to apologize. Don't say no, he informed you, it was written that. No, once even it was written, if he said to you, you have to trust the patient. Clear? Yes, Dr. Ala, continue. Other comment?
Yeah, so this scenario, as you have mentioned now, that we will take it from the patient and then we'll apply it as a medical error.
Yes.
So it's not mentioned in the scenario that they didn't
Yeah.
give him they didn't inform him about the side effect. Only
Yes,
the patient mentioned.
yes, it was mentioned only during the discussion. But when the scenario, I read the scenario back to read the task, it was medical error. But it was the first scenario for me. That's why I couldn't focus on it.
But it's mentioned in the task. It's medical
Yeah, it
error.
was yeah, it was medical error. But I
Okay, Dr.
couldn't.
Barting.
Yeah, I
Yeah,
couldn't
sorry.
know the error where exactly. But
Okay.
when I explore with the patient, he told me that no one informed him about this side effect. I told him, the consultant told you, he said he wasn't consultant and he didn't inform. So it's like double mistake. The junior doctor sat with him and he didn't tell him about the mistake, the side effects. So it's
Yeah. So they are usually giving a clue inside the scenario that it's a medical error.
it's not a clue only. The task itself will be clear.
Yeah.
Error or not error.
Okay, good.
Okay, so you have to read every word and every sentence in the scenario outside. But with the stress, Dr. Ala, you can skip even the patient name. Okay.
Okay,
That,
Dr. Bata,
yeah.
I'm sorry, I have questions.
Mhm.
Yes, you did all of the steps of
Yes.
the medical
Yeah.
error, or just
Yes.
you are apologize and you read the incident
Apologize,
report?
incident report, consultant meeting, root cause analysis, all of them, and they mention it as a positive comment that it was done, the incident report, root cause analysis, and the medical action. Of course, I told him we will stop the medication temporary, and according to the condition, we'll try to resume it back if your condition is stable.
Okay.
Okay. Any other question?
No, thank you.
Any comment, Dr. Mahmoud?
Thank you, Dr. Bassem. Thank you very much.
Back to the comment here, Dr. Aisha. Investigation about what happened, gradually tapering steroid. Yes, this is what I mentioned. Replace another medication by gut doctor advice. Urgently consult bone doctor exactly involved about further plan. In future, we will avoid steroid and any exacerbation. So you don't talk about the future, since he's now in acute presentation of avascular necrosis. You don't know what will happen. Maybe the steroid will be in the best interest, but he will take the protective, bone protective. Maybe in this scenario he didn't take. Of course he didn't take because it was even not mentioned the side effects. Legal action, yes, insert report, yes, I mentioned. Is it medical? Why not say side effect? No, it's not side effect. If it was side effect, the patient will receive the calcium and vitamin D. If it happened, although of this medication, yes, you can say it's one of the side effects, and some patients will
It
respond
is
to the.
not osteoporosis, Dr. Bassem, it's different. So even if they will take,
Yes, sorry, yes. Yeah,
yes,
you're
so
right.
it is different. So it
Yes,
is
you're right.
a side
Yeah,
effect,
I
yes,
mix.
but we should mention to the patient about this
Yes.
side effect.
Yeah, I'm talking about vitamin D and
Yes, but
calcium for
nothing can prevent
osteoporosis.
it.
Yes, you're
Just
right.
we can say we giving the lowest dose to treat you and to avoid the hazard or bad effect.
Yes, you're right. Sorry, I mix. I said about the osteoporosis. No, it's not osteoporosis, and calcium vitamin D is not replacement, or it will not help. It's one of the possible side effects that might happen, although it's not common. However, we will follow up you, and we'll try to prevent this medication and to pick up early. And patient said no one explained for her, yes, steroid, but should we take her word as truth? Exactly, with no doubt. Apologize without doing any investigation before. Yes, you will do all of this without investigation, since he's saying that. Any place for citizen advice in terms of changing job or employment? Should you mention enema, will not you be blaming the patient for refusing? Yeah, about the job, as I said, don't mention he sponsored by some company or no. Just tell him, since you are unable to walk or to even use your leg, we will give you sick leave. Okay, if you will go for with the dilemma of company or he's taxi driver by his own, you'll not finish the dilemma of this support or the occupational thing. So just offer him sick leave, and if he need any kind of support, we'll provide him. That's it. Regarding enema, will not. Yeah, yes, it's not. As I mentioned, it's not like this. We didn't mean to give you the other medication because you are not taking the first medication. This is what you mean, Dr. Gabriel? I couldn't understand. I tried to understand it.
Yeah,
Should you?
what I meant was I was just thinking, I think the candidate was saying that because the patient is used to accept the animal, that was something like that in the scenario that was prescribed. So I was just thinking that if you mentioned that, if you say that at all, wouldn't you in a way be blaming the patient for refusing the animal?
Yeah, never ever blame a patient. He has the right to take or to refuse or not to take the medication. So don't say or don't blame him. Okay.
Okay. Yeah.
Yeah, it's good not to blame the patient. It's again the welfare. At the end, this is his right to accept or to refuse. This is his right. You will explain the drawbacks of not receiving this medicine, but you will not tell him because if you didn't do, we do that. Okay, so don't blame him. At the end, this is his right, and the option he choose, it's belong to him only. Clear now?
Yeah. Thank you.
Oh, okay. Thank you, Dr. Gabriel. Next, anyone has comments, please? Anyone want to add suggestion or to ask? Any question?
No, Dr. Walter.
Okay, anyone want to add to clarify things? Again, the steroid as a concern, will you stop the steroid was one of the concerns, and the answer was no, it shouldn't be stopped abruptly. Take care of this point. It's a medical and clinical judgment. Any patient on steroid, although the steroid have side effects, you can say we will hold it and they will refer you to the doctor. And the medication shouldn't be stopped. Why? If you stop it abruptly, the patient might have additional crisis, right? Despite the side effects happened, yeah, we will try to take care of it, but it's difficult to stop the steroid abruptly, especially those patients who was dependent on the steroid. This is one of the clinical judgment points. Don't stop the steroid. Even the complication happen, you can hold it and to start to taper it down after controlling the side effect.
The take-home message today, really.
Yes, yeah.
Yes.
It's very important because the steroid comes as counseling. A steroid comes as side effect and comes as additional crisis. So you have to know about these things.
Yes.
Okay,
If
thank
he
you. Yeah.
if he asks, is it reversible?
Reversible, good question. So what do you think?
Because there is option of surgery, or I don't
Yeah,
know.
there is. Yeah, there is. Of course, there is, especially if the necrosis is already established. There is option of replacement, hip replacement, right?
Yes.
So you don't know at what stage he is having this complication. The best answer is to refer him. We will refer you, or we will call the bone doctor to know if is it already established or just early stage. You can continue, or you have to do the surgery. Whenever you are stuck with information, ask the specialist. Not specialist, I mean the registrar, no, the specialized team. Because it's not your scope, right? It's beyond our scope as IM even, internal medicine. This is something related to the orthopedic. He will know if this bone is already damaged or no.
So
And
I will tell him I will include
Exactly.
you and doctor to assess you like that.
Exactly, yes. So the bone doctor will tell us if it's already it's damaged or reversible, or it can be recovered, or if it's established. This is the time for the surgery, which is replacement therapy, hip replacement therapy. Okay.
Yeah.
Any other comment or question? Clear for all?
Dear Dr. Bassem.
Okay, thank you, Dr. Mahmoud and Dr. Sarah. I'll see you tomorrow, inshallah, with long clinical consultation day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
So thank you, Dr. Walter.
Thank you, everyone. Thank you.